Hi, my name is Arthur. I live in Raleigh, North Carolina, and I'm a patient living with CIDP. I was diagnosed with CIDP when I was 51 years old, and I was started on IVIG just 2 weeks after my diagnosis. When I was on IVIG, I would visit my doctor, and they would ask me, are you feeling stronger? How is your level of weakness, when you're from month to month when you're on the treatment? But I found that on IVIG, I would feel weakness, I would have my infusion, and after a few days, I would regain strength, and it would last until my next infusion, and then the weakness would return. And it went that way from month to month with every infusion. During my up and down cycles, I'd find that I couldn't always do the things that I wanted to do. While I had the strength, things seemed fine. But then during the weak times, I just found myself not being able to do simple things like cut the grass or wash the car, things like that. So, that's a constant cycle for me month after month. I first learned about Hizentra during a symposium with the GBS CIDP Foundation. I saw the banner, and I went over to them and was like, what's going on here? What is this? One of the people, they explained it to me. We sat down and talked about it. I really liked the idea that I could infuse myself when I wanted, wherever I wanted. The freedom that it would give me to be able to take it with me was really something that I wanted to experience. They gave me some more information for me to take back to my neurologist. And after about 6 months more of being on IVIG, my neurologist and we started on Hizentra. And after I was on it for about a month, the company gave me a 3-month trial. We were like, yeah, let's do this. When I was infusing with IVIG, I would have to, at first I was at the infusion centers, which took quite a while. But then when I started home infusions, my infusions went anywhere from 6 to 8 hours. Compared to Hizentra, I can infuse with Hizentra in about an hour and a half. So it really made a huge difference in not having to go to an infusion center or be at home waiting for a nurse to show up, which was kind of disruptive because my wife, she has her own business, and so we would have to schedule even vacations and trips and everything around the nurse's visit. Well, since I've been on Hizentra, I feel that I have more of a stable level of energy from day to day compared to IVIG, where I had the ups and downs from one infusion to the next. But with Hizentra, because of the steady dose, I find that I don't have those waiting periods from one infusion to the next. As soon as I get the infusion, I'm ready to pick right back up where I left off with my life. For me, it wasn't difficult transitioning from IVIG to doing an infusions myself. Because I haven't done it before, I was curious as to how it would go. But when I realized that it was just the size of an insulin needle, I didn't see it being that bad. With some people, they may not feel anything at all. Others may feel a little pinch that not really significant. Everyone is different. I do use the 10-gram prefilled syringes. I find that with the prefilled syringes, although there are a few more steps involved, it's as simple as just taking the syringe, putting it in the pump, and going. And when you have to sit around waiting for an infusion to get done, using a prefilled syringe makes it so much more efficient. To someone who's on the fence about trying Hizentra, I would say to them, unless you like waiting around for an infusion nurse to come to your home, unless you like making trips to the infusion center and sitting there waiting to have your infusion done, I would be a little more open-minded and maybe giving it a try. When talking with anyone, I would always say check with your doctor to make sure that Hizentra is right for you. Since Hizentra, I've been able to do some of the things that I haven't been able to do since my diagnosis. I'm able to travel with my wife. We're able to even do the smaller things like take walks in the park. Now I'm able to do yard work, and I'm even able to work out, which I found difficult before. It's just given me a sense that my life is more normal than it would be otherwise. It's given my life a lot more freedom.
Important safety information. Warning. Thrombosis, blood clots, can occur with immune globulin products, including Hizentra. Risk factors can include advanced age, prolonged immobilization, a history of blood clotting or hyperviscosity, blood thickness, use of estrogens, installed vascular catheters, and cardiovascular risk factors. If you are at high risk of blood clots, your doctor will prescribe Hizentra at the minimum dose and infusion rate practicable and will monitor for signs of clotting events and hyperviscosity. Always drink sufficient fluids before infusing Hizentra. See your doctor for a full explanation and the full prescribing information for complete boxed warning. Hizentra, immune globulin subcutaneous, human, 20% liquid, is a prescription medicine used to treat primary immune deficiency, PI, in patients 2 years and older, and chronic inflammatory demyelinating polyneuropathy, CIDP, in adults. Treatment with Hizentra might not be possible if your doctor determines you have hyperprolinemia, too much proline in the blood, or are IgA deficient with antibodies to IgA and a history of hypersensitivity. Tell your doctor if you have previously had a severe allergic reaction, including anaphylaxis, to the administration of human immune globulin. Tell your doctor right away, or go to the emergency room if you have hives, trouble breathing, wheezing, dizziness, or fainting. These could be signs of a bad allergic reaction. Inform your doctor of any medications you are taking, as well as any medical conditions you may have had, especially if you have a history of diseases related to the heart or blood vessels, or have been immobile for some time. Inform your physician if you are pregnant or nursing or plan to become pregnant. Infuse Hizentra under your skin only. Do not inject into a blood vessel. Self-administer Hizentra only after having been taught to do so by your doctor or other healthcare professional and having received dosing instructions for treating your condition. Immediately report to your physician any of the following symptoms, which could be signs of serious adverse reactions to Hizentra: reduced urination, sudden weight gain, or swelling in your legs, possible signs of a kidney problem, pain and/or swelling or discoloration of an arm or leg, unexplained shortness of breath, chest pain or discomfort that worsens on deep breathing, unexplained rapid pulse, or numbness or weakness on one side of the body, possible signs of a blood clot, bad headache with nausea, vomiting, stiff neck, fever, and sensitivity to light, possible signs of meningitis, brown or red urine, rapid heart rate, yellowing of the skin or eyes, chest pains or breathing trouble, fever over 100 degrees Fahrenheit, possible symptoms of other conditions that require prompt treatment. Hizentra is made from human blood. The risk of transmission of infectious agents, including viruses and, theoretically, the Creutzfeldt-Jakob disease, CJD agent, and its variant, VCJD, cannot be completely eliminated. The most common side effects in the clinical trials for Hizentra include redness, swelling, itching and/or bruising at the infusion site, headache, chest, joint, or back pain, diarrhea, tiredness, cough, rash, itching, fever, nausea, and vomiting. These are not the only side effects possible. Tell your doctor about any side effect that bothers you or does not go away. Before receiving any vaccine, tell immunizing physician if you have had recent therapy with Hizentra, as effectiveness of the vaccine could be compromised. Please see full prescribing information for Hizentra, including boxed warning and the patient product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. You can also report side effects to CSL Behring's Pharmacovigilance Department at 1-866-915-6958.